Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, now in the serous central retinopathy, so if you see the clinical features of serous central retinopathy, here it occurs mainly in the male patient who is actually a type A personality with anxiety features of anxiety, or who is anxious for most of the times. In them we see, or we can say that a businessman who has lots of stress. Okay, in them we see this central serous retinopathy. Here actual clinical features are the patient will develop sudden onset of sorry there is sudden onset of blurring of vision is seen, which is typically painless. There is sudden onset of painless blurring of vision is seen, along with micropsia and metamorphopsia. Micropsia and metamorphopsia are the objects might look either small or the objects might look deformed. The visual acuity will be 6 by 9 or 6 by 12. Mild visual loss will be seen in the patient. Along with that, when you see the through the ophthalmoscopy, you will see that there is elevation of the sensory retina at the posterior pole will occur, with borders will be glistening, and thus you can see a reflex which is called as ring reflex. Because there is elevation of sensory retina at the posterior pole, so this is uh, the retinal pigment epithelium. This is the neurosensory retina. Because of this elevation, you can see that the glistening borders resulting in ring reflex is seen. So on fluorescein angiography, right, on fluorescein angiography we can see the presence of ink blot or smokestack sign is seen in central serous retinopathy. Similarly, if you do an optical coherence test, the central serous retinopathy will have, you can see that this is the retinal pigment epithelium. This is the neurosensory retina which is elevated like this in the retinal. This is neurosensory retina which is elevated. This is the retinal pigment epithelium. Okay. So actually, if I have to draw the diagram here, this is the, see, I don't know whether it is conveyed properly or not. So this is the eye. Okay. So there is retinal pigment epithelium. So this epithelium is defective. As a result, there is elevation will be something like this. So this is the neurosensory retina. This is the retinal pigment epithelium. So there is elevation of retinal pigment epithelium is seen, and here there is fluid is seen. Okay, so this is central serous retinopathy. So even here, if this is the eye like this, then this is neurosensory retina. This is retinal pigment epithelium. Right. So this is also almost similar, but just that elevation is over this. So this is the retinal pigment epithelium. This is the neurosensory retina which is elevated like this. Sorry, a little mistake in drawing.
thank you and thank you for watching.